In 1918, the world faced one of the worst pandemics in modern history, the Spanish flu, a virus that spread faster than any government could understand, and that left deep marks on science, health, and society. But what exactly was the Spanish flu? How did it originate? How long did it last? Who were the main victims? And how did the disease finally disappear? To understand this pandemic, we need to go back to the end of World War I. The planet was exhausted, devastated, and in constant military movement. Millions of soldiers traveled across borders daily, a perfect scenario for the spread of an unknown virus. The conditions were ideal for something devastating. The flu did not originate in Spain. In fact, it probably started in the United States, at a military camp in Kansas. But Spain became globally known for a simple reason. It was one of the only countries without war censorship. While nations at war hid news to avoid damaging the morale of the population, the Spanish press reported everything. Thus, the world believed that the outbreak came from there, and the name Spanish flu spread as quickly as the virus itself. Today we know that the responsible was the influenza A virus, subtype H1N1, extremely contagious, aggressive, and with rapid mutations. At the time, there were no antivirals, antibiotics, or modern ventilators. It was an uneven battle. The virus had three waves. The first, at the beginning of 1918, was relatively mild. It seemed like a common flu, but few imagined what would come next. The second wave, between August and December of 1918, was deadly. The virus mutated and became much more aggressive. In some cities, people died hours after showing the first symptoms. The mortality rate was frightening, especially among young adults, between 20 and 40 years old, something completely unexpected for the flu. In just a few months, more than one-third of the Earth's population was infected. It is likely that between 50 and 100 million people have died, more than twice the victims of the First World War itself. But why was the disease so deadly among the young? The main hypothesis is the so-called cytokine storm, an exaggerated reaction of the immune system. The strongest were, ironically, the most vulnerable. Basic measures were adopted: cloth masks, distancing, closure of schools, churches, and theaters. But everything was improvised. There was not enough scientific knowledge to understand the enemy. People tried everything, from camphor inhalations to home remedies. Some believed in alcohol, others in onions. Nothing worked. Entire cities have collapsed. In some places, there weren't enough coffins. In others, public transportation stopped due to a lack of living or healthy staff. The economic impact was devastating. Businesses went bankrupt, factories closed, and the post-war recovery became even slower. The pandemic lasted about 2 years, with peaks between 1918 and 1919. The third wave, already less deadly, ended in 1920. So after all, how did the Spanish flu end? The most widely accepted explanation today is twofold. The virus finally lost strength due to mutation, becoming less lethal, and many people were already immune because they had survived the initial infection. In 1920, the world was beginning to breathe again. But the pandemic left deep lessons: the importance of science, transparent communication, and global vigilance. Today, many pandemic protocols, such as quarantine, mask wearing, contact tracing, and public hygiene, originated from the experiences lived during that time. A century later, we still study the Spanish flu. It shaped modern medicine, inspired research, and prepared us, at least in part, for challenges like the H1N1 virus of 2009 and the recent COVID-19. The history of the Spanish flu is the story of an unprepared world facing an invisible enemy, but it is also the story of human resilience, scientific progress, and our ability to learn from the past. And perhaps the greatest lesson is this: when humanity unites, even the greatest challenges can be overcome. Thank you for watching. If you want to support the channel and keep receiving documentaries like this, subscribe and share this video. See you next time.